feeling like a big virtual lecture. We'll see how it goes. For now, if you have a question, feel free to either like unmute yourself and just jump in or put it in the chat, and I'll do my best to answer them efficiently so we can get through a lot of questions in this hour.
Hi, I have a question. So I plan on graduating in December, and I was wondering how, because I've been taking a peek at some secondaries and they ask, if you're not going to be a full-time student in this academic year, or if you're taking a gap year, how should I approach that if I only am taking one semester off of school, I guess, before I would start medical school?
Yeah, I think if you, at the time you submit your application, you won't have graduated. So I'm not sure that you have to disclose that to them. And certainly you wouldn't have plans for one thing, what if something goes awry and you end up having to withdraw from one of your classes that you need for your major or something, right? I'm not suggesting that will happen, but God forbid you're in a car accident and you're in the hospital for a week or something, and it just seems like it's easier to just graduate with the rest of your class. So I don't think you're obligated to tell them about something that you plan to do that isn't a for sure thing. And definitely, at this point, you wouldn't have a plan set up for what you're going to do next January. So it's not like you can even tell them, and I'm going to do this cool thing. I don't think you need to. I think you can send that in an update letter later when it's relevant.
All right, thank you.
Hi, I had a question about the letters of rec. So I understand that there's a packet that's sent out to all the different schools and it's not really customizable. And I was wondering if there's any disadvantage to sending a packet with, let's say, 6 letters in addition to the cover letter, and maybe a school wants 3 max. I was wondering if that would be perceived differently, or how does that work?
I think 5 is a max for most undergrads. I think it's pretty rare that you have 6 equally meaningful letters that are really going to be genuinely valued by the admissions committee that all know you genuinely well. Mm-hmm. So I think if you're trying to figure out which one to cut, that's a great question to have with your PreHealth advisor. Okay.
And then in terms of the general amount of letters, that shouldn't be a problem if I include let's say.
No, every school we send, on my AMCAS this year, obviously you guys haven't submitted yet. On my AMCAS this year, I have 357 records. So we send a lot of people out there, to all medical schools every year. They know what to expect from us. They see our packets every year. I've never had a medical school complain to me or say, please, try to get kids to send fewer letters or whatever. They seem to value what we send. So don't worry about it. One standardized packet is going to be just fine.
Okay, thank you so much.
But thank you for asking that, because I bet 10 people on the call have that same question. Okay, let me see. That looks like there's, when should I take the Casper if I'm applying this cycle? I think, Dr. Pankowski recommends May, or, sort of by the beginning of June, if you can fit it in. I think it takes a couple of weeks for those scores to get reported to medical schools as well. So, if your Casper score can be there, if they're using it as a pre-interview screening tool, as they're looking over your application, that's probably optimal. And then it says, I plan on taking 2 gap years to work and explore another field before I'm applying. I'm aware of the expiration of MCAT scores. What other things should I be aware of when applying in this manner? Will I still be able to receive the same guidance from WashU as an alum? So absolutely, I'm going to answer the second question first. You are ours forever. You can take 5 gap years. Maybe you're going to go in the Peace Corps, and then you're going to come back and restudy for the MCAT. And so you're going to have 4 cycles out and you're going to have 5 gap years altogether. We would love to work with you. So you've never aged out of eligibility for our advising. I would say if you're taking 2 gap years to explore another field, you're going to have to be really careful about sort of a narrative. If you do circle back to medicine, about You know, how did you make that decision? If it doesn't appear that you have a connection to medicine while you're doing something else, that could raise questions. Again, that's probably strategizing with your individual pre-health advisor. Should we order the official transcript to give to AMCAS now, even though we cannot submit the application at this time? I don't think that's critical. I think you can, and I doubt they will lose it because they're all electronic now. So I think they're pretty easy to keep track of. But, you know, because they're electronic, they also like go overnight. So I don't think it's, you know, essential to send it today. Should we have a finalized transcript when we order a finalized school list when we order transcripts? Not necessarily. I think, you know, people will probably, some people will submit on June 3rd with, you know, 3 or 4 schools while they're still shaping up their final list while their AMCAS is in verification, and that's fine. I ordered mine as hold for grades. Do we know when those will go out? I do not know that. That is a question for the registrar's office. Should we have an actual count of community service hours? AMCAS is going to ask on each of your activities for a time period and the number of hours that you spent during that time period. You can enter, I think, I haven't seen this year's, but in the past, up to 4 different time periods. So, for example, you asked about community service, but the research example is possibly more intuitive. Lots of people work 10 hours a week during their sophomore year. So from, you know, September through May of their sophomore year, they'll enter 10 hours a week, and then they're full-time in the summer. So from in June and July of that summer, then they'll have another period where it's maybe 45 or 50 hours a week. And then the following year, maybe they're, you know, working on a senior thesis and trying to amp up their research a little bit. So they'll have a third period of time that's maybe 15 hours a week. So similarly, if you have different levels of engagement in a service activity during different periods of time, different years in school or summer versus school year, you can use that, you know, sort of different time periods feature of the activities section to denote that. For transcript orders through parchment, should we include the transcript request form the AAMC provides us as an attachment? I think that's a good idea. It can't possibly hurt. And I think you just upload it. This is the parchment thing is new, but I think that it goes with your request. You don't fax it to the registrar's office anymore. Let's see, how should we enter hours for hobbies on AMCAS, since that's not really something we usually keep track of? I mean, I think that's not going to be examined carefully. That seems like as long as you don't enter something crazy or silly, it will be fine. How does miscellaneous community service count in then, like if you volunteered for 2 days at a vaccine clinic, for example? I think, you know, if you're grouping several, you know, spot, you know, service activities together. So during my 4 years as an undergrad, I did, you know, 4 or 5 different things for 1 or 2 days apiece. I think you can just list one time period for your entire undergraduate, put the total number of hours for all of those activities, and then detail what the activities were in your 700 character activity description. If we take gap years and work, would having a recommendation from our manager boss be a good idea? Yes, absolutely. I think if you, especially if you've been working in a clinical setting, but honestly, even if you haven't, you know, whatever you've been working at, I would want an employer recommendation. Now, if you're just starting the job as you're applying and you'll be interviewing while you're applying, you would not necessarily have an employer recommendation. But if you're taking 2 gap years, so you're working full-time for a year and then applying, yes, you should have an employer recommendation. How should we input expected hours? I think that's going to be the same. You know, how many hours a week are you going to work during what time period? Your start time has to be like now or something in the past, but your end time can be in the future. If it's 40 hours a week, then how many weeks are you listing? Times 40. How would you suggest going about listing Dean's List in the AMCAS work activities section in terms of the date and hours? I really don't think you have to put dates and hours down for honors. That's clearly not, you know, a relevant field for that. And I don't think it's a required field. So I think you can just move on from that. If they've made that a required field this year, enter anything. It's obviously just a placeholder. You know, you don't need a date. How should we list shadowing in the activities section if we've shadowed multiple different positions? Again, I think you can list maybe into the physician shadowing as the title of the activity. And then in the 700 characters that you have, you can list either the specialties or the names of the physicians you shadowed. You know, it depends a little bit on how many you're trying to do. It's a little bit of a style question, but you should be able to lump several shadowing experiences together into one activity. Do you have any recommendations for the description of a publication, also for hours? I see that Dr. Downey is also on this call. Joan, do you have any advice there on hours? I mean, again, on a publication, I'm not sure many people track how much time they spend on the actual writing.
Yeah, I think you should be incorporating that in the, I worked 6 hours a week in the lab, or I worked 10 hours a week in the lab. Careful not to micromanage hours. You don't really want to be like that honors question, that's 0 hours. You didn't do anything, a computer computed your honors for Dean's List. At the same token, I've seen applications get tanked when they listed a hobby like running for 2,000 hours. Yeah, that could have been true if you ran that many hours a week, but you have to back and ask, you know, do you really want to put some hobby that is so many more hours than, you know, fundamental work, either academic or research or service? So in this process, modesty goes a lot further than exaggeration. So if you didn't do anything for it, just say 0 or 1 hour a month, something realistic.
I think that's a great point. I also, you know, I had the opportunity to sit in on an executive admissions committee meeting. They invited a bunch of advisors to sit on a committee meeting at University of Michigan. And it was interesting to hear, you know, the physicians who are on, you know, who'd been interviewing people and who were discussing candidates. They were making up down decisions about admit or not. You know, they would sort of say not very complimentary things when the total number of hours kind of exceeded what is just realistic in a week or a month. And so I would say as a final check, you know, put down what you think it should be for everything, but then go back and look at what's the holistic impression of how many hours you have in your days and weeks, and does it seem realistic or does it seem like you're padding? Okay, let's see. I'm graduating a semester early. Should I have my plans figured out for the spring semester and summer before anticipated medical school matriculation before applying? No, I don't think that's necessary. I don't think that would be necessary under the best of circumstances, and coming out of a pandemic is not the best of circumstances. No one expects you to know what you're doing next January right now. Can we list a publication if it will be submitted in June after I submit my AMCAS application? I think it's fine to list, you know, that you're in your research description. I think you should list that you expect to be submitting a publication. I don't know that I would list it as a separate entry. That's, but I think this is a style issue and it's your call.
I would follow their directions very specifically. They are trying to improve that with like submission or in galley form or in revision, you know, the kind of different stages that journal articles have for you. The most important one that we want to see is submitted, because after that, it could take, you know, some, depending on the journal, it's not really within your control whether it actually gets published or whatever. The second you get accepted and published, you should be updating the school about that. And please check to see whether AMCAS has allowed that section to have real-time revision. That's something that I hope they will do, because they've never allowed that before, but it makes more sense for the student to be able to say, you know, I submitted it and then it was accepted, but it's not published yet, right? It's in that. But follow their rules exactly, because you don't want them to think you've exaggerated. Lots of people write papers that never go anywhere. Like they do research, they summarize it, and it's an internal document, but it doesn't actually go through, you know, the additional hard work of getting it out. So be really honest. This is at the stage of imperfection where language was before. And if you look at language now, it is really nicely nuanced. You know, I speak a language, but a native speaker would know I'm not a native speaker. It's really got nice nuances to keep you from inadvertently, not meaning to, but looking like you're exaggerating. So they got the language part thing good. We're trying to get the publication stages properly reflective so students don't have to, you know, email a school that doesn't accept emails, that kind of inequity across the nation. But they have very clear rules in the AMCAS. And if it's not accepted for publication, you don't get to check the box that says publication. There's, you know, so Carolyn is right. You want to make sure that if it's right before that, you really put that in that, that description of, you know, your research work, which most likely, if you've gotten to publication, might be one of your most meaningful, so you would have more space. But if it's not, you know, at least try to tell us that, you know, submitted to 2 journals. We all know that you have to submit to one journal before you can be rejected, and then you take it to the next journal. I mean, that is unfortunately the process. The more you can prod your PI to move that along, the more you can do, the better for you.
For shadowing multiple physicians, and my answer to this is going to be relevant to like a bunch of questions. So it says follow-up question about shadowing multiple physicians. Who should we put as the contact? So if you're lumping a bunch of physicians together, I think you can list the contact as the physician you spent the most time with, or somebody that you know the best, like maybe one of them is a family friend or something. But this is your lowest stakes decision in this process. No, none of these people are actually going to be contacted. I mean, the chances of anyone calling any of your contacts for any of your activities are very, very slim. I think the reason AMCAS asks for that these are required fields is really to force you to think through, you know, is this real stuff that I'm putting down? Or, you know, would I want somebody to be asked about this? And I want you all to represent your records, you know, very honestly, very transparently, because you're going to have to talk about them in the interview. So if you're like making them like a little better than they really were, you're not going to be able to talk about them all that well. So it's really important. And I think the AMCAS application format is designed to push you to be, you know, honest and not, you know, over ambitious. I mean, we do send conflicting messages in this culture. We say, put your best foot forward, but we also say, you know, integrity is really important. And so there's a line there. I want you to be sure that you're not padding your application, but the contacts are really not going to be contacted. So don't fret about that.
You could, as Carolyn said, list the person that dominated that experience, but you could also say in 4 words, and I shadowed a cardiologist and a surgeon. That covers it. You don't put the contact information for those because you're not telling us how many hours with that person.
Let's see. I am having trouble making my cursor work here. Let's see. besides especially in contact info, do we need a description for shadowing or is it not necessary? I mean, I think if you can say something about what you learned, that is always beneficial in an activities section. But you know, how much space you have, you know, that's a little bit, and how much did you address it in other aspects of your application, maybe in your personal statement or something. So that's going to be a style issue and it's going to be more in the context of your complete application. Let's see, how do we list pending publications? I think that Dr. Downey actually covered that. So if that's still a question, maybe you can repost in the chat with more details. Let's see, if we're taking 2 gap years, do we ask professors for rec letters senior year, or do we reach out to them a year later? So this is an opinion, but I think you should have all of your letters on file before you leave town. I think trying to chase them down as an alum, if something is not getting submitted promptly, is extremely anxiety producing and sometimes just downright difficult. Even though we're not physically here, you know, you're not physically with your faculty this semester, you're more connected to them than you're going to be a year from now. So I would do the asking now. If you're very close to a faculty member and they know that you're taking 2 gap years and they say they'd rather write in a year, then that's fine. But if they don't know you well enough to be really, you know, to really have a clear picture of you when you know, talk to them a year from now, if you're not going to be following up with them in a couple of casual emails about, you know, updates, how things are going for you, I would ask now. Should we list a research presentation such as one at the undergraduate research symposium as a separate entry from the actual research experience? I mean, I think that is also a style question. It depends on what your narrative is. It depends on how much emphasis you're putting on research. It depends on how many, you know, what you're going to have to set. What's the opportunity cost? Like, what do you have to give up to put undergraduate research symposium in one of your 15 slots? If you don't have to give up anything, then maybe it's fine. So I think that it is a hard question to answer in the abstract. If you need help figuring that out in your specific circumstances, I think your PreHealth advisor is a great person to process that with. Let's see. If we're taking 2 gap years in a non-clinical setting, is it better to spend more time volunteering or shadowing? Or does it depend on what we've already done so far? So you can never have too much service. You just can't. You can never have too much service. And I think, you know, I don't think you want to think about, is it better to spend my time volunteering or? And I'll invite certainly Dr. Downey to, you know, give another opinion. I think you want to look like somebody who you can't imagine not incorporating service into your life. Like, I never don't have enough time to brush my teeth in the morning. I could be late for a meeting with the chancellor. I still have a minute to brush my teeth. And I think you want to be the kind of person that service is important to you. It is an essential part of who you are. You're just not going to be out in the world without it. You know, are there other important things you're going to accomplish? Of course, but I think that needs to always have, you know, a primary place in just who you are and how you operate in the world. I do think that clinical experience is crucial. If you don't understand the physician role, if you don't have direct contact with patients, you're not gonna, you know, if you're not connected to medicine during a gap year, I think it's gonna be harder to tell your story and tell a compelling story about why medicine. But I still think you don't really want to ever, you know, maybe you'll have less service if you're working full time and you're, you know, trying to shadow every Saturday, and there isn't an opportunity to actually do clinical service. You know, maybe you have less service. Maybe it's one Sunday a month that you're on a habitat build or something, but I still think you want it to be consistent and regular. And that's probably more important than the specific number of hours.
I would agree with that, Carolyn. I think if you have to choose, let's say you were working a 50-hour work week for 2 years in a non-clinical setting. I don't think you should be shadowing. I think you should be volunteering, because shadowing is not service to anyone except yourself. Shadowing is evidence that you've learned about the field. By then, I mean, if you're unsure, and maybe that's the point of the 2 years, then yes, shadowing could be feeding the information you need to come back and be a committed applicant. That's, I mean, shadowing is intake information for you, but it is not service to anyone. So if you have to make a lot of money in a gap year or paying off loans or whatever, I would target service in that very limited free time that you have. And I think that the United Ways searchable volunteer engine is probably the best in the nation for finding those opportunities that are just like 1 hour or 3 hours. But Carolyn's point is, make sure it's consistent, because you want to be the person that they say he or she can't get enough of service. This is what you're coming to. You're serving people in a healthcare setting or arena in the world of healthcare. So you have to be consistent, and volunteering is free. So the judgment is harsh if you really have 2 full years with 0, because you got to jury rig something that looks like it's from the heart. Like this isn't integral to who you are, or you should be rethinking the commitment. And shadowing is good information to help you think through the commitment. I don't, but it's end game stuff, not, not a substitute for service.
Okay, so there's a question about how to coordinate parchment with AMCAS. And I know Ms. Hyger has a bunch of really noisy construction going on at her house. So I'm not sure that she will be able to jump in here. Maybe she will just jump into the chat if I say anything wrong. So I don't think you are coordinating parchment with AMCAS. You are ordering your transcripts on Webstack. Our registrar's office is using parchment to send them. Is that true?
Yeah, so once you are in Webstack, it's actually going to take you to a parchment portal from my understanding. So this is secondhand through the registrar's office, but they have told me that the way it works is you just log in to your Webstack, parchment has you make an account with them, and then you'll select that you're sending an e-delivery to AMCAS, and you'll be able to attach your transcript request form there.
And actually, I think if you need more guidance beyond that, I think the registrar's office is in a better position to help you than we are, quite frankly. The next question is, I did a research internship in high school that resulted in a publication. Can I still list it? Absolutely. I think if you did publication worthy research at any point, I think that can be shared, so, exactly when you conducted the research is probably not critical. I don't know if I'd make it a most meaningful experience, but I think it belongs on your activities list if you have room for it. How do we determine which medical schools would be a good fit? How many medical schools would you recommend we apply to? Thank you. Okay. So first of all, we have an entire junior jumpstart session on this tomorrow. Dean Kiefer is going to lead, is going to moderate a discussion among some students who were really successful this past cycle in applying to medical school. And she'll talk to them about how they whittled down their school lists and how they ascertained whether they were going to be a good fit for the schools they were applying to. So I really, really strongly recommend that you come to that live. She's also got some slides that are already published today that she would love for you to look at to have kind of a knowledge foundation before you come to that discussion. And those are out there in your agenda on the conference platform. I think that 15 schools is plenty. And I think obviously there are a few people that are going to have special circumstances that this is not going to apply to. But if so, you and your pre-health advisor have already identified that you are special. For most people, 15 schools is plenty, and 20 is probably an absolute upper boundary. Every year at Junior Jumpstart, the one thing I hear from these incredibly successful students over and over again is that, they applied to 20 schools, but after 17 secondaries, they just kind of ran out of gas. They just I don't think that very many people can really get through many more than 15, 16, 17 of these extensive essays that have to be thoroughly researched so that they are really personalized to that school in this really compressed time frame that you have to do it in. And doing a rush job on them or kind of doing them half-heartedly doesn't make any sense at all. Like doing more of them badly clearly cannot be the answer. So limit, make yourself choose which are really going to be the schools that are a good fit for you. In terms of like, how do you know what school is a good fit for you? I think that's first of all, knowing yourself. Like, what do you really care about? What kinds of opportunities at schools would be really attractive to you? What do you want to make sure they include in their curriculum? If you want to do rural medicine, don't go to Harvard. You have to drive a really long ways to get to a hospital where you're going to see any rural patients. So obviously that's an extreme example, but there are other ways in which schools honestly have different emphases and different personalities. Now, how do you learn about that? It's a huge research job. This is like writing a thesis. You're going to look at a ton of primary source material and try to synthesize it into and make meaning out of it for yourself. Like a good thesis, it should also be fun. You're dreaming about your future. So it shouldn't be an onerous task, even if it's a big task. And it says, are secondaries for a given school fairly consistent across years? Do people rewrite them? I think many secondaries are consistent from one year to the next. Yes, sometimes people do pre-write them. And if you've got downtime, I think there's nothing wrong with taking a stab at that. In fact, this is the only good use for Student Doctor Network. You should not look at anything else on there. All the rest of it's lies. But the self-reports of secondary questions are usually fairly factual. So I think it's fine to look at Student Doctor Network for that. Let's see. Oh, am I out of questions here? Oh, we're only half an hour in. Oh, let's see. What should I do if my pre-health advisor is not listed? Oh, that doesn't matter. Don't worry about that. We used to make advisor assignments in the PIR system. We don't need to anymore. We're switching to a new set of software. And so we haven't deleted that field because we don't want to mess up anything else, but it's not an important field. Which letters are the essential letters of recommendation? That is a really fair question. So I think most people should submit their request cover letter. Most people should hit that request cover letter button when all of their letters of recommendation are received. However, inevitably, every year, there will be some students who are waiting on a final letter, and it's not clear whether it's really going to come in or not. And they might send it later, or they might hope it comes in by the time their cover letter is actually written and ready for posting. So if you feel like if a letter is not showing up and you feel like you've got a good enough set of letters that you are going to go ahead and apply, even if that letter never comes in, it's okay to request us to start working on your cover letter. Should we plan for interviews being in person this cycle, or can we assume we will have the option to do a virtual interview if we are not able to travel? Boy, if only I had a crystal ball. Even 3 months ago, I was saying, I think interviews will still be virtual next year. I don't know now. I don't know. I am hoping that schools will at least offer a virtual option, but I'm not the boss of them.
I'd like to say that people are really pleased with the improved equity of access to and the diminished cost, which you need to prepare for and prepare your family for in the range of $5,000. This is a very expensive process, which means it can be unequitable, and everyone is really pleased at the less cost. It is expensive to do all this virtual stuff. It's not zero sum to the med schools, but we did it for residencies and internships, and really improved, you know, the spread of who was able to look at our programs and who we could look at. So I don't see it going away, and I think everyone will want to make it equitable so that if it's better for you to, less expensive for you to do the first pass. I mean, I do think in the end, it's virtually, I would have a hard time selecting a school having never laid eyes on them. So in the end, there's going to be some travel, but I think people were pleased and happy, and I don't think anyone wants it to go back all the way to only travel, because that was running in the range of $5,000. And all it took was, you know, one California to New York Thanksgiving interview, and, you know, that was $1,400 kind of thing. So I want you to plan for the virtual component, but so I think you can still, for example, let's say you decide travel, you can still send to a school an email that says, you know, dear Columbia, I will be interviewing in Mount Sinai, you know, December 28th. If you would so honor me with an interview, I would very much like to bring down my financial costs. This is not going to get you interviewed. This is going to get a very well-run system to look ahead and say, oh, she was on track. We're going to, you know, and they are working to bring down the cost. None of us want it to be expensive. So that's an okay email, not bad. They can try, but they can also say, we can't do that.
If I have to, I mean, I don't have a crystal ball. And if I just had to like make stuff up, if I had to just, you know, take my turn at predicting the future, I would say that it's, to me, seems highly likely that selective institutions like the WashUs of the world are definitely going to continue to offer a virtual option. I think that's very likely. I don't know if all state schools are going to stay there. I mean, they are taking more of their class from a geographically, you know, achievable region. It's more a drive than a flight. And there may be state schools that decide to go completely back in person for interviews or mostly back in person. But it is true that I think if you're, you know, even if you have to interview in person at a few places, I think at many schools you would be able to opt for a virtual interview if that's, you know, financially important. Are there scholarships from, let's see, oh dear, where did that go? Oh, do you have any advice for finding opportunities for clinical experience during COVID? I mean, I've been people to get a job, honestly, because for sure, if you are, you know, if you have a paid role, you're doing something valuable, and people who with jobs are not just welcome to come to work, they're expected to come to work. You know, if volunteering at hospitals opens back up, I don't know when, you know, I just don't know what to expect there. Yes, the CDC has changed their guidance, but hospitals by definition are enriched for vulnerable populations and maybe for people who are unable to receive the vaccine for I just don't know how hospitals are going to feel about any additional risk that doesn't come with some added benefit for the patient. I don't expect that to be ramping up rapidly. Are there scholarships from the WashU or the federal government for costs associated with the application? So this is a really hard thing. There's definitely not money from the federal government for applying to medical school. There are fee waivers and like the fee assistance program through AMCAS. There are fee waivers for secondary fees at medical schools. And there may even be some travel assistance from individual medical schools if they're insisting on in-person interviews. It is not possible for the Student Financial Services Office to change your award in any way to include your expenses for postgraduate. So you can't, your financial aid package can only cover your undergraduate education. Nothing to do with graduate school can come into it. And that's frustrating and hard, but that is the way the law is written. The Student Success Center does have some resources. And so if you need, whether it's a suit or whether it's, you've got a mandatory in-person interview at a state school or whatever it is, I definitely want you to go to talk to somebody over there, because we want every WashU student to have the resources they need to be successful. Okay. Let's see, where do we find information to help us determine a school's fit aside from their mission statement and website? Well, again, from a couple of really successful WashU students about what resources they utilize tomorrow, and I strongly suggest you tuning into that. So first of all, I would do a couple of things. If I had a particular interest, I wanted to work with, migrant agricultural workers, I would, Google some keywords with that and then tack on medical school and see what institutions popped up, right? If there's somebody that's doing a lot of really innovative things in a space that I really care about, then that would say something about fit to me. So that's one avenue I would try, is what do I care about and how do I find the medical schools that seem to be, kind of doing something special in that regard. But I think if they're, if that didn't yield enough for me, then I think I would just, I would look at beyond their mission statement. I would look at their social media, the things they're tweeting about or what they care about. Look at if they publish their alumni and stakeholders magazine, the equivalent of the WashU Med's Outlook. If they've got an online copy of that, see what they're bragging about. That's going to tell you something about the values of that school. And that's going to tell you something about what they want to invest in, and therefore what kind of people they want to be able to take advantage of those investments.
Also, look at the student groups. Everyone has a student affairs website equivalent, and the student groups, yes, they come from within, but there's also nurturing from divisions and departments and faculty involvement. And just like at WashU, you can find a great home amongst that.
Is the order that our recommendation letters appear in the packet important? You will get very specific instructions by email once your cover letter is ready. If we go over in minute detail here, with screenshots, which buttons to press, your cover letter isn't going to be ready for over a month from now anyway, and you'll have forgotten it all. Well, you're going to get a detailed email with instructions. So don't worry too much about the how do I do it in the PIR system. I think, I would put my strongest letters first, for sure. And what does strongest mean? That's gonna depend on your profile and your narrative. Again, that's a great discussion, I think, to have individually with your PreHealth advisor if you feel like you really, if you have a conundrum there. let's see. I understand that medical schools will ask about a C or a D on our transcript. Maybe. I don't know that they all would, but they might. However, if we received a few, I'm having trouble, a few B's in the basic sciences, is that something we should be prepared to explain? And I think if there are things in your transcript that seem like an irregularity, you could be asked about that. But I honestly think that sometimes when they're asking about that, they really want to hear like how you think through when things are not going well, because there's also going to be times in medical school when things are not going well. And how do you respond to that? Do you get defensive? Do you, are you, thoughtful and, effective at analyzing, what you might do differently or what you have done differently in the past when you've met up with a challenge? So I think it's more about the tone of your response than about the sort of specific facts that are being interrogated. Let's see. When should I take the Casper if I'm applying this cycle? I think May is a great answer for that. Okay. Alrighty. We have another little pause in questions. We'll have some wait time to see if more emerge. And it is fine to unmute yourself and just ask, since we don't have a rapid fire. All right. We might be at an end of the sort of quick help here. Oh, wait, we have one more come in. Let's see. How do you recommend that we talk about research outside of the basic sciences or clinical settings? I mean, I think if I were interviewing somebody for medical school, I would be really interested if they were doing research in something that, didn't have any direct tie to medicine. I would want to hear, why they were excited about it. I would also want to hear, something ideally about how they feel that skills or competencies that they honed there are going to serve them in medical school. So I think, your genuine interest in this thing that is, separate from medicine is exciting. We just want to see, intellectual curiosity about a broad array of things, I think, in candidates. But in addition, your self-awareness that you developed transferable skills and competencies that are going to be important in your future would be kind of an ideal combination.
I think.
Oh, Dr. Downey, you just muted yourself. There you go.
I think it's a great suggestion to look at the slide that had the medical school competencies, because I can envision that if you wrote, if you reviewed 17th century French authors, if you looked at some of those competencies, you would see yourself there. They're transferable completely. The ones on the far right, your interest in hypothesis-driven science and healthcare, well, that's very specific to MD, but the vast majority of the competencies are really transferable if you were a musician, an artist, a reader of French literature. So speak to those research activities outside of basic science and clinical settings with pride and with the same level of enthusiasm that you would if it had been a hypothesis-driven basic science project. And if it's that important, it should have been one of your most meaningful.
All right, well, we're closing up on time here as well. So thanks everybody who's, I know this has been, everybody is beyond done Zooming. So thanks everybody who continues to be willing to Zoom with us through Junior Jumpstart here. We do really appreciate the, the dedication that and persistence you're putting into this hard end of a semester. We'll see you tomorrow.